I was just sitting in my office one day and it felt like all of a sudden on my left side I went completely underwater, like my hearing just went. And when they looked at the MRI, they saw that I had an acoustic neuroma. That's when I started doing research on where would be a good place to go, and I ended up here at Duke.
Skull-based tumors occur underneath the brain, so in the space where the brain rests on top of the skull bones. Some ability that you have, that you cherish, is governed by some portion of your brain that can be affected by a tumor.
When we talk about lateral skull-based tumors, we mean things that are in and around the ear and affect hearing, balance, and facial function.
The most common tumor we see in the lateral skull base is known as an acoustic neuroma or vestibular schwannoma. The second most common is a meningioma. Both of those are benign tumors. Because they arise near the structures of the inner ear, patients often present with hearing loss.
So once they come in, they usually will have a hearing test.
Cowboy, baseball,
and what's called an ENG, a vestibular test to test their balance.
Hear them but can't understand them.
The skull-based team really places the patient experience as of critical importance, and the nurse navigator is really central to that mission.
I'm in communication with both the ENT and the neurosurgeon. I work with both of them.
We have one person who is there to help the patient through the entire process. I always tell the patients, she's going to be your new best friend.
What we do is we are there as a liaison and a coordinator and a point person. We see them from their first initial consult. We help educate them. We help in some cases reassure them.
Trish wanted to say hello.
Hi Deb. Good to see you too. You are awesome.
Thank you.
It enables the patient to have a one point of contact for somebody that knows exactly what they're going to have done, what they're going through.
The nurse coordinator is just somebody it's easy to reach out to and talk about just even planning on what hotel to stay at, what should I tell my family, things like that.
In our program, we have a very strong philosophy that the quality of life is as important as the quantity of a life. And so every time we see a patient with a skull-based tumor, we spend some time getting to know the patient, getting to know what's important to them, what gives their life meaning, and then we can use that information to talk together and decide as a team what would be best for that individual person.
We want to match the threat posed by the tumor to the risks that accompany the treatment.
Historically, many of these tumors were operated on, but there has been a trend in recent years to observe more and more of these tumors since they are benign. With regard to actually treating the tumor, there are typically two options. One is microsurgery, to go in and remove the tumor. The good thing about this treatment option is that we are able to get rid of the tumor. A lot of patients like knowing that the tumor has been removed. They don't have to think about it anymore.
Dr. Francis spent a lot of time with me going through, here's all the options, and it really came down to, at this point, because of the size of the tumor, it was surgery.
The third option in treating these tumors is known as stereotactic radiation therapy.
And our goal is really to prevent them from growing and causing more problems. Basically, our goal is to stop it dead in its tracks.
I felt very comfortable and confident in that they listened to me and that they explained everything thoroughly. They had the level of experience. These are the type of things where it's not very common, so you want somebody who has a lot of experience doing these.
They're rare, but they're not rare for our team here, and I think it's important for a patient to seek out a center where the tumor isn't rare.